أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم Subhanaka la ilma lana illa ma 'allamtana. I welcome you all to Lajna UK's first live health webinar. Our topic today is what you need to know about COVID-19, and the speaker is Dr. Sadiya Ayaz. London-based GP, Sadiya is also a GP trainer and a GP appraiser. So Sadiya, are you good to start?
I am Jazakallah. Auzubillahi minash shaitanir rajeem. Bismillahir rahmanir rahim. Assalamu alaikum wa rahmatullah, everyone. Jazakallah for taking the time out to join us on this Sunday morning for our very first Lajna Health webinar hosted by Lajna UK. I'd like to start by thanking Sadiya Ayaz for this brilliant initiative and for allowing me this opportunity. Inshallah, this will be the first of many such webinars by our Lajna. So over the next hour or so, we'll be covering a topic of which we have all, I think, to some extent, become our own experts on, either by choice or necessity. A platform we come across these days, whether that be our WhatsApp groups or Twitter accounts, our phone conversations or the discussions we're having in our own homes, I think it's fair to say that our lives have pretty much become saturated with information about COVID-19. Some of that information will be factual and useful to us, but some of it may also be giving us an incorrect description of what this virus is actually about and what it actually means for us. And so the aim of the webinar today is to provide you with a more accurate picture of what this pandemic actually means for us and our families, as members of the public and as patients, and also what it means for us as GPs taking care of you. So the aims and objectives of what I would like to cover today are as follows. To give you a brief overview of what COVID-19 is and how it spreads, typical and atypical presentations of this virus, especially in children and older adults, standard approach to the medical treatment that's received in the hospital, the impact of COVID-19 in the community, the sort of questions I get asked by my patients about COVID-19 and what I tell them, what we can be doing to look after our health at this time, what we envisage may be the long-term impact of this virus on our health and well-being, and how we might try to address this. And hopefully at the end, we'll also have an opportunity to answer some of your questions as well. I'll tell you now, I'm by no means an expert on COVID-19, and I must emphasize that some of what we discuss will be a personal perspective based on my experience in my own clinical practice. So please always make sure you seek appropriate medical advice from your own GP or specialist if you have any queries or concerns about anything that we discuss today. What I will say in my capacity as a GP is that I have seen a number of patients with this virus in the community, and it is like no other virus that we have come across before. It's not simply the flu, the pace at which it is spread, the way in which patients have fallen severely ill with it, and the way it has had a cascading effect on multiple organs within our bodies, makes it probably the greatest challenge the medical profession has ever faced. What is COVID-19 and how has it managed to take over the world? Well, at some point in late 2019, we know that a new coronavirus jumped species from animals to humans, probably from horseshoe bats in the Hubei province of China. It rapidly became a human-to-human infection, and it was able to use a common receptor in the nose and upper airways of humans to transmit efficiently from one person to another. There are several different types of coronavirus, some of which are like the common cold we experience every winter. Others are more severe, for example, SARS or MERS, which you may have come across or heard of. COVID-19 is caused by the SARS-CoV-2 virus, which is a new or novel coronavirus that has not previously been identified in humans. We do not have a specific treatment for this virus, and we do not currently have a vaccine. What also makes COVID-19 a greater concern is that although the number of people dying from this virus is around 3% of the total population, it has a very high transmission rate, which causes a significant impact on the population and results in a higher number of deaths. As you will know, the UK now has the highest death rate in Europe and the second highest in the world after the United States, with over 30,000 people having died of this virus in this country in the last 3 months, which is obviously a very significant number. There are two ways in which people will catch COVID-19. The first is droplet spread, produced by people coughing or sneezing, or even talking or singing or breathing. These droplets go directly through people's mouth into the mucous membranes, and the droplets can be carried up to a 2-meter distance, but sometimes even more. The second mode of spread is through touching a contaminated surface, hence this huge public health drive that we've had over these last few months to cover our face when coughing or sneezing and to wash our hands. Washing hands with soap and water actually damages the liquid around the virus and is in fact the most effective way of trying to get rid of it. So I often get asked, how long does the virus live on surfaces? It's a common question and something day to day we do come across. So the virus is relatively easy to get off surfaces. Most normal soaps and detergents will kill it, and its viability rapidly drops over time. So it's unlikely to be viable beyond 72 hours on any surface. On copper, as you can see, it only lasts a few hours. On softer things like cardboard, it lasts for a lesser time than it does on stainless steel surfaces. Some people also worry about the virus spreading from food, but there's no evidence that the virus lasts longer on food than on any other surface. The Food Standard Agency, for example, advised just taking general precautions with handling food as we probably would do normally, washing our hands before we prepare food, cooking or eating food, and using soapy water and making sure that we wash utensils and surfaces thoroughly before and after use. So let's talk a little bit about the symptoms of COVID-19. There are some typical symptoms that we come across, but there are also some atypical or less common symptoms that we also find, and it's important not to ignore those as well because they could be related to the virus. So symptoms of mild or early infection can often be quite non-specific. Many patients complain just of a generalized tiredness, feeling fatigued, and this may be for a couple of days. Most will develop a fever or cough, and additionally there can be muscle aches, headaches, chills, and sore throat. Cases of diarrhea and vomiting have also been noted, and abdominal pain as well, and also these can be seen in the absence of other symptoms, and this should also raise the suspicion of possible COVID-19 infection. Also something that we do find quite commonly with this virus is losing a sense of smell. But remember, even patients who have mild symptoms can be highly contagious. So research shows that people are probably infected for about 2 to 3 days before the onset of symptoms, and then they become significantly infectious for a few days afterwards, and then the infectivity rapidly drops after about 7 days, but as you probably know, people can remain infected for even up to 2 weeks. That's why other members of your household are advised to self-isolate for 14 days, even if they don't have symptoms, but you do. The test for COVID-19, a swab from the back of the nose and throat, is able to pick up genetic material, viral RNA, from the virus as early as the first day of somebody getting symptoms, and it usually peaks within the first week. And in most studies, it's found to be undetectable after around 3 weeks. We also know that a number of people get this virus without any symptoms at all, but what we don't actually know is how much of that contributes to this pandemic. And like I said, most people do recover within about a week, but I do often find that patients will complain of a dry cough that can linger on for some weeks afterwards. Some people also report a chest heaviness or a tightness for some time afterwards. But being a virus, remember, antibiotics are unlikely to make much difference to this. They're only going to be helpful if there may be felt to be a secondary bacterial component to the infection. So what about COVID-19 in children? So COVID-19 appears to affect children less often and with less severity generally, with a lot of children having asymptomatic infection as well. In children, it's important to look out for things like a high temperature, a new and continuous cough, but again, as with adults, we also do find atypical features such as diarrhea and abdominal pain as well. And recently, you may also have come across on the news, there has been concern of a number of children requiring intensive care due to a multi-inflammatory state where they become very seriously and very quickly unwell. Such children have found to have features that are commonly seen in another rare vascular condition called Kawasaki's syndrome, Kawasaki's disease. So all children who've had this severe condition have obviously been seriously unwell with it and have required intensive care. And we've found that abdominal pain and diarrhea and vomiting are often a common feature in this. Doctors suspect that this may be because there is a post-infection inflammatory response where the immune system basically goes into a sort of overdrive in children who have either got COVID or have had recent infection with COVID-19. But according to the Royal College of Paediatrics and Child Health, there have only been a few such cases in the UK to date, so the numbers are very low. It's understandable there is a concern from parents, and there isn't one specific sign or symptom that a child with this condition presents with, but there are things that are important to look out for, and these being things like persistently high fever, rapid fast breathing, cold hands and feet, unusual abdominal symptoms and sleepiness. And if there is any concern of any sort with anything like that, then the advice is always to get urgent medical help because children can deteriorate very quickly. So that's an important message to take home. And as you can see on the slide there as well, the Royal College of Paediatrics and Child Health have also designed this useful summary table which advises parents of the signs and symptoms to look out for if your child is unwell. But remember, it is a guide, and if you are concerned at any point, it goes without saying that you should always get your child seen to. So COVID-19 in older adults. We also see more atypical symptoms in older people with this virus, where symptoms such as confusion or lethargy, feeling very tired and weak, falls, reduced appetite, all quite non-specific symptoms can actually be quite common and related to infection with this. So again, important to look out for those if you've got older family members or if you're an older person yourself. The typical fever and cough is not always seen, and in fact 20 to 30% of elderly patients, they are only going to be presenting with fever and cough. Many won't. The biggest risk factor of dying from this disease is age. But it goes to say that the chances of dying of any infection are also generally higher with age. The second risk factor is gender. We've seen that there's been a higher mortality rate in men, and we don't as yet know why that might be. The third risk factor is what we call comorbidities. So that's other diseases that people may have which can make them more susceptible. So things like heart disease, diabetes, chronic lung disease, a suppressed immune system, kidney disease, liver disease, and obesity. The Office of National Statistics, or ONS, showed that most people in the UK who died of COVID-19 did have at least one other comorbidity. Hence the government's guidance to inform all those in very high-risk groups to stay at home, and some of them to shield. We also know that there are some ethnic groups that are at greater risk from this virus, and again, there's been a lot in the news about that recently. There are higher rates we are seeing in people of Black, Asian, or minority ethnic groups. And again, there are a lot of questions being asked as to why this might be. One reason is because of comorbidities that they may have that predisposes them to this virus. Some of it may be the jobs that they do or socioeconomic factors that put them at greater risk. And genetic factors may also be playing a role in this. So we know that some people with COVID-19 will become seriously unwell and require hospitalization. What we're worryingly finding is that some patients who do become very ill will have a reluctance to go into hospital for medical care because they fear they might get infected or not receive the right sort of care and die as a result. And also there is a worry about not having loved ones around due to visiting restrictions that are currently in place in hospital. And all of that is very understandable at this time. But we know that COVID-19 is a serious illness. When someone's condition deteriorates with this virus, they do require urgent help, which is often in hospital. And although there is that worry about going into hospital and getting infections, not getting seen to is much more of a risk. And hospitals have lots of means of minimizing the spread of infection. And that's something that you might hear me saying repeatedly in this webinar, that take-home message that please don't ignore any worrying symptoms. If there is any concern, the risk of delaying treatment is far, far greater than being seen to in a timely manner. Around 5% of people who are severely ill with this will require admission into intensive care. And in intensive care, most patients, but not all, may be put on a ventilator, which is a machine that helps do the breathing work of the lungs. There are also other less invasive methods by which breathing can be assisted, because as we know, this condition affects the lungs. It also affects other organs in the body, but more so the lungs, and people can become very breathless with very low oxygen levels and with a sudden deterioration. So sometimes they may just require an oxygen mask, and sometimes they may require more specialized non-invasive support. So there's something called CPAP, continuous positive airway pressure. But there are a number of these patients who will also require a ventilator when they become severely unwell. Data from the Intensive Care National Audit and Research Centre showed, in fact, that 60% of patients who do receive ventilation within 24 hours of admission. And obviously this tells us that people do become unwell very quickly with this, and the risk of delaying hospitalization obviously can have very significant impact on people. And shouldn't be delayed. So those people who need to be placed on a ventilator may be in intensive care from 10 to 14 days, but they may also require treatment for even up to 3 weeks. And a lot of families, again, at this time worry about how their loved ones may be managed in intensive care. Intensive care units are essentially specialist wards set up to provide treatment and close monitoring for patients who are very ill and can't be cared for on a general hospital ward. They have staffing that provides one-to-one care, and also intensive care staff are very well aware of how anxious family members would be at this time, especially, and they always try to ensure that they remain regularly updated on a patient's condition, even if they can't see them. And it's also important that when family members are communicating with hospitals, that there is one named family contact through whom all communication is made, because this can also save time for hospital staff not having to repeat information, or the risk of miscommunication if lots of family members are asking the same questions. And then as soon as somebody's well enough, they will be moved back out of intensive care to a general hospital ward. Some patients may leave after a few days, but some may need a longer road to recovery, which may be weeks or even months. Decisions for ventilator treatment are also made very much on a case-by-case basis. Age, which again some people worry about, is by no means a reason alone for its refusal. Lots of factors are taken into consideration. For example, any other coexisting medical problems a person may have, their frailty, so what their function was like before they came into hospital, how much they could do for themselves, how much care they required for day-to-day activities, and any prior wishes that they may have had about their treatment. So all of that is very important and is always taken into consideration. And any decisions that are made by hospitals are always discussed with the family. So how has COVID-19 affected our work as GPs? Well, as anyone who has probably had contact with a GP practice over these last few weeks will know, we've had to also get used to a very different way of working in these last couple of weeks and months. The majority of our work is undertaken now through telephone or video consulting, and this is essentially to avoid patients coming into surgeries and risking the spread of infection. And it's been obviously a huge change. It's required us getting used to this new setup very quickly and without very little warning, not to mention all the technology that's come along with it. But what we are finding is that a lot of medical problems can actually be dealt with through this virtual means now. Things that we never thought we could be doing over the phone, we actually find are quite easy, and we are able to do. So things like medication reviews, asthma checks, postnatal checks, assessing physical and mental health complaints that patients may call up about, and also excluding any worrying symptoms that patients have. And most of this we can now undertake over the phone. So we can also issue medical sick notes if needed. We can also issue prescriptions over the phone. And in fact, talking about prescriptions, we are now encouraging all patients to set up medication requests online. So if you are on any repeat regular medications and you don't already have an online setup, it's something I would very much encourage you to do through your GP practice. And it basically means that you don't need to be coming in with paper requests anymore. You can have this online setup where your prescriptions are directly sent electronically to any nominated pharmacy in the area, or even if you are out of the area, they can also be sent there. So that's something that's really important and very much recommended at this time. Also, I suppose on the topic of medication, it is worth mentioning that people are worried about how much supply of medications there's going to be, and whether in this pandemic we are going to be running out of essential medications. And people are in fact stockpiling. For example, we see people requesting extra supplies of inhalers just in case they may get sick. But what this does then mean is that people who do need these medications regularly as part of their daily regime may not be getting their supplies because there does ultimately end up being a shortage of them. So again, important to bear in mind, if you aren't needing the medication and it's more of a concern of not having it at some point, don't pre-order them just in case. Because at the moment, if everybody gets what they want when they need it, then hopefully we shouldn't have any issues with medication supplies. It's always worth keeping about a month's supply of your medication so you don't run out, because we don't want that to happen either. But anything more than that probably really isn't needed at this time. And the other thing that comes to mind also about medication is the concern that some parents have, patients have as well, about the use of ibuprofen, because there was a study not long ago about it making the symptoms of COVID worse, and there was this huge scare and everybody was taking ibuprofen off the shelves. And this was actually thought to be because ibuprofen is an anti-inflammatory and it can dampen down the immune system. So people thought that if this was being taken, it may slow recovery from the virus. But there hasn't been any compelling evidence for that. In my own practice, I'm telling patients generally try to take paracetamol first if you can, because ibuprofen can sometimes also cause other medical problems like acute kidney problems if you are unwell anyway. So it may not be the best thing to take if you are suffering from any sort of infection. But again, speak with your GP, and if it is a medication you have been prescribed to take regularly, then there may be a good reason for you to continue with it. So generally, in general practice, we are seeing far few patients face to face, and those who do come in are always assessed over the telephone first by a doctor or a nurse to make sure basically it's safe for them to do so and safe for us to see them. And most practices have set up what are known as hot and cold zones. So any patients who come in and have to be assessed with potential COVID symptoms can be seen in a separate area that is away from the rest of the practice and patients to make sure they are seen safely. We're also strongly encouraging parents to still continue to book in children for immunizations. Please don't delay these because of the worry about the pandemic. They are vitally important for your child, and missing them increases susceptibility to many serious infections. So that's my second take-home message for our listeners. And then hot hubs are the other thing that are coming up in some CCGs and some regions within the area. These are basically clinics that are being set up to see patients solely with COVID-related symptoms. So they're essentially being assessed, and either they're being managed in the community or being sent to hospitals if they are particularly unwell. And this is to reduce the number of patients, these patients attending GP practices. It's fair to say that COVID-19 has impacted on all our lives, but again, coming back to my point about getting seen to, it shouldn't stop people from contacting their GP. That's a very, very important message, and the worry is that we aren't seeing enough patients that we need to be seeing. I don't think that we need to be seeing. I don't think we'd be saying this 6 months ago, but that is the real concern in the NHS at the moment, and there is a real drive to try and get patients coming in at the right time if there are medical concerns. For example, if someone finds a lump or a mole or is concerned about any symptoms that could potentially be suggestive of cancer in particular, we are advising them to contact their GP straight away. People should know that GP surgeries are still very much open, even though they may be in a different sort of way, and patients should feel reassured that processes are in place to make sure that when they are seen in a safe way. Make sure that the premises are kept clean, that we adhere to guidelines on social distancing, PPE and so forth. So the worry of becoming infected if you're going to see your GP should hopefully not be there, knowing that practices are doing as much as possible to minimise the risk of spread of infection. And the same goes for the hospital setting as well. But there is this real worry at this time about patients not attending hospital appointments, not coming to see their GP. But please remember, the NHS is still very much open for business. I often see patients, hear from them who have got worrying symptoms, chest pain, for example, breathing difficulties, and it sometimes requires real convincing to try and get them to go into hospital. So please don't ignore that and make sure you do get help when you need to. So there are a lot of questions around COVID. Some of them we may have answers to, some of them we may not. But what I wanted to spend a little bit of time doing now is just answering some of the frequently asked questions I get from my own patients in my practice around COVID-19 and the sort of answers I'm giving them. Some of them, like I said again, will be based on my own practice, but hopefully they will be a helpful guide to you as well. So one thing I think we all have had questions about, and I often get asked, is should I wear a face mask when I go outdoors? Yes, I think it's a good idea to wear a face mask when going outdoors, although it's not compulsory in this country as it is in some. It's important to remember that face masks don't protect us from getting the virus, but they can help reduce its spread to others. And even with a face mask, don't forget you still have to maintain all the social distancing measures and the regular hand washing. The type of face mask obviously can make some difference. So the surgical grade, the N95 masks offer the highest level of protection that are available in hospitals. But actually, even a cloth mask can give you some level of protection, so it's better than nothing. And I would strongly encourage, if you don't already, do utilize these when you are going outdoors, especially food shopping or anything else as well. There is a good purpose and a good role for them. Can I get COVID-19 more than once? Possibly, yes, but we don't quite know yet whether this is a definite or not. The coronavirus hasn't really been around long enough for us to know how long our immunity against it will last. Some studies show that patients can be reinfected after a year. Others say that it may be after 2 years, but this is all still very much sort of in speculation. We don't have the evidence, unfortunately, at this time for it. There have been some reports also that people can get multiple infections in a short space of time. But again, why this is, we're not sure. Is it because people are getting reinfected after a short course of time? Is it because there is a reactivation of the virus? Or is it because the testing in the first place has been inaccurate? So the jury is still very much still out on this. And like I said, it will only really be with time that we will have the answers for it. There also have been some studies that suggest that the degree of immunity that we get is based on the severity of our symptoms. So people who may have milder symptoms may not develop enough immunity to prevent against future infections, and those who have more severe symptoms may have a better immune response. But research is very ongoing, and it will only be over the next maybe 6 months to a year that the answers to such questions will be had. So a family member in my household has been told to shield. What do I need to do? Again, a common question we often get asked. So shielding, as I'm sure you know, has been put in place for those at greatest risk of getting COVID-19. And a letter was sent out to all patients who were thought to be in this very high risk group from the government. The list of those you can see summarized here. And during this time, shielded patients are basically advised to stay at home at all times They can register with the Gov UK website for extra support, for example, getting priority supermarket deliveries and so forth. But the guidance very much is for them to be staying at home. So if you're living with somebody who's shielding, it can be difficult, especially if you've got limited space. But you should try to minimize the time you spend in shared spaces as much as possible. So for example, kitchens, dining areas, try to make sure that you aren't sitting together, you're not sitting closely together. It may mean that you will have to eat your meals separately. If you have a separate bathroom, I would encourage using that, using separate towels and utensils. So it can be quite difficult, but it's really trying to work around what is the best way to manage that situation and trying to maintain those social distance measures as far as you can. Similarly, if a shielded person requires an essential carer who's come, they can continue to visit the shielded patient, unless of course they have any symptoms of COVID-19 themselves. But again, important to reiterate to anyone visiting for that purpose to make sure they undertake stringent hand washing when they come and when they leave as well. So what about attending hospital appointments if you're shielding? Apart from the patients who are extremely vulnerable, it's also important to remember that there is also a group of moderate risk patients, those who are also at a high risk of developing COVID-19 and the complications of it as well. And these include people who are over the age of 70, people who have other comorbidities such as lung conditions, asthma that may not be severe, heart disease, diabetes, kidney or liver disease, obesity, so the things we mentioned earlier on. And these patients, these people are advised also to stay at home and only really leave the house if it's absolutely necessary. So patients like these, if they have hospital appointments coming up, what sort of advice do we give them? Well, it's always important to check what sort of appointment it is with your specialist or your GP. Some hospital appointments may be important for you to attend, and not turning up can actually cause unnecessary delays in any treatments or investigations. So always do check either with your specialist or GP. Most hospitals are contacting patients directly beforehand and telling them either their appointment has been cancelled or postponed. And many are actually undertaking appointments, as we are in general practice, through virtual consulting, so through either video consulting or telephone reviews, in secondary care as well. Patients also often say to me that I'm worried about a symptom, doctor, but I don't want to go to hospital. Again, like we spoke about the risks, and again, the worry is about delayed diagnosis for serious conditions such as cancer, which if we sit on, we know get worse, and then that can delay treatment and it can delay and worsen prognosis as well. So again, don't sit on these symptoms. It's hard to convince patients to go to hospital at this time, but we are seeing much fewer number of patients attending GP practices and hospitals with what we call red flag or worrying symptoms that could be suggestive of cancer. And in fact, there has been a significant 25% in England alone of suspected cancer referrals over this time, which is a real concern for us. And every week that goes on for means that over 2,300 cancer cases are likely to be going undiagnosed in this country every year. And that, you can imagine, at the end of this pandemic will result in a huge number of people who will either have an undiagnosed cancer or advanced cancer. So it has huge implications for the health service, but of course for the individual as well. So please ensure that you do get seen to if needed. So what about cancer screening at this time? Well, cancer screening programs, the three main programs in the UK, which are for breast, bowel and cervical screening, have unfortunately had to be delayed because of the pandemic. And it's been a difficult decision for the NHS because we know how important these screening programs are, and we're always encouraging patients to attend them regularly. But because of the pressures on the NHS, this decision had to be made. The teams running these screening programs are of course ensuring that anyone who's had a previous abnormal test is not lost to follow up, but will be seen to in due course once the screening programs are up and running again. If again you are worried about your screening and want some support and advice at this time, the National Screening Service is still very much available for this. And I've also put on here the number for Cancer Research UK, who are also available to give any guidance or advice at this time that may be helpful to you. So what about pregnancy and COVID-19? So pregnant women do not appear to be more susceptible to COVID-19 than the general population. It's thought that the majority of pregnant women will experience only mild to moderate symptoms. There have been few cases of some pregnant women becoming more unwell, usually in the third trimester of the pregnancy, but there are generally fewer cases that we see. But it is important to remember that anyone who's pregnant who has an underlying heart or lung condition, such as asthma, may need to take extra precautions at this time. Please also ensure that you stay up to date with all your antenatal checks. Please don't miss these. These are important checks during the pregnancy. And also if you have any other pregnancy related appointments, for example, any scans or blood tests, do check with your hospital or your midwife to make sure that these are not forgotten about. Transmission from mother to baby is possible, but the significance on babies is not yet known. There have been very few cases in babies. And at the moment, there is no evidence that the virus can be carried in breast milk. A lot of people have also had to take time off work because of being ill with COVID symptoms themselves, or if they've had a family member who's been unwell and they're having to self-isolate as a result of that. And some people inevitably worry about being off work at this time and the implications of that. And I do often get asked for medical supporting letters for them to give to work, so that they have the authorization of being able to stay at home. With regards to COVID-related symptoms, patients can and should self-certify for the 7 days as normal, and they can do this without contacting their GP. But if someone stays unwell beyond 7 days and is unable to return to work, you can actually use the NHS 111 website, which actually provides a self-isolation note for work. So you actually don't need to contact your GP if you need time off work in relation to government guidance regarding self-isolation. GPs can obviously provide medical certificates for the purpose of illness. That's not in relation to this government advice. But employers are actually responsible for putting in place arrangements for working from home. And sometimes there is a worry amongst people about whether they should be at work or not and how much risk they're at. And I always advise discussing this with your employer and seeing what the options are available to you. As GPs, we can't make that decision when it's not on the basis of a medical condition that necessitates your staying at home. So can I get tested for COVID-19, and if so, how? So as we know, there's been this huge drive to get people tested at the moment. Currently in England, all essential workers, including NHS and social care staff, are eligible for COVID-19 testing, as is anyone over the age of 65 who might have symptoms, anyone with symptoms whose work can't be done from home, and anyone who lives with any of the above. And you can see that list on the screen. Care home residents are also being tested. Now, patients can self-refer for a free test via the gov.uk website if they are eligible. And as I mentioned earlier on, the test ideally should be taken during the first 3 days of onset of symptoms. Drive-through test centres are available in some places, and others offer home test kits as well, depending on the area in which you are. The current test that is available for COVID-19 is a swab from the back of the throat and the nose, and it's what we call an antigen test. So it tells us if we currently have the infection. It won't tell us if we've had it in the past. There isn't as yet a reliable antibody test, which is what would tell us if we have had the infection previously. But this is in process, and the government are hoping that one may be available possibly by the end of this month. People are tested essentially because, one, to diagnose them individually, but testing is also important because it tells us how the virus has spread. It also helps frontline workers getting back into work, and also it helps the government decide on social distancing measures and lockdown strategies as well. So it is very much needed, and hence we are trying to ensure that more and more people do get tested. We're also hearing about this new contact tracing app. So contact tracing is something that's already been used in various countries, for example, Germany, Hong Kong, Singapore, and the UK is planning to roll out something similar over the next few weeks as well. What this will entail is members of the public being allowed to download an app. It's a free app that's available on a smartphone, and it's designed to trace recent contacts of anyone with the virus. So the app will track users who come into contact with one another, and if the user develops symptoms of COVID-19, they put their details on the app, which then informs the NHS, and this triggers an anonymous alert to users with whom there has been contact, asking them to either self-isolate or to be tested. And the reason for this is basically, again, to try and contain the spread of infection as quickly and as far as possible. And we'll be hearing more about that, I'm sure, over the next coming weeks and months. It's been piloted in the Isle of Wight, and the plan is to roll it out across the UK by the end of this month. And finally, are there any particular precautions we need to be taking in Ramzan to prevent infection with COVID-19? Well, Hazur Ayudah Ta'ala bin Aziz advised us on this in a recent Friday sermon with regards to fasting during this time, and he said that everyone should make their own judgment on the basis of their own condition. Obviously, if you have symptoms and are unwell, you shouldn't fast. And for those fasting, it's important that you do make sure that you are looking after yourselves well, so keeping well hydrated between fasts, trying to eat a healthy diet, as we're also not so active during this time because of lockdown, and so our metabolism also slows down. And also trying to make sure you are getting your 8 hours of sleep, because we know that is important to maintain a healthy immune system. So finally, how can we try and stay well during this pandemic, and what can we be doing to look after ourselves? Well, firstly, it's important not to ignore any other pre-existing medical conditions that we may have. So your diabetes or blood pressure, chronic airway disease, asthma. Having these conditions well controlled is really, really important, especially at this time, because it makes one less susceptible to getting infections. Make sure you don't miss your medications, and make sure you order them in good time. If you are due a blood test or a medication review for any chronic disease monitoring, contact your GP, as these may need to be arranged even with all that's going on, depending on what treatment you're on. And the same goes, of course, with looking after our mental well-being. depression and anxiety have become so much more prominent during this lockdown, and we see so many more patients presenting with these symptoms at this time. People can feel very overwhelmed with the worry that they or a family member may become unwell, where they should go and when they should go to get help. And there's this real genuine fear of getting help because of those risks and the worry. But it's important to also bear in mind that the situation with COVID-19 is changing day by day. This can make uncertainty worse because we don't know how long all of this might last. What we knew 10 weeks ago, for example, about this virus is very different to what we know about it now. And we can't predict, despite all the medical evidence that is still coming about, what's going to happen with this in the next few months. But actually, what I would say is that accepting this can take the feeling of pressure and overwhelm away from us. Even when my patients ask me, when do we think all of this is going to end, I tell them with absolute honesty that none of us know. We really do have to take this one day at a time and focus on all the positive things that we have around us. And in fact, it's actually a reminder that nothing is within our control, and the biggest uncertainty is in fact life itself. So we should try to embrace this as best as we can, and not let ourselves get tied up in the so many worries of the what ifs with all of this. Being grateful is so important to negate the negative thoughts that can very easily set in. I always say to my patients, talk about your emotions, talk about how you're feeling with others, share those concerns, because most people will be feeling them as well. It's a very helpful way to offload. And also, if you know that somebody might be struggling with their mental health, reach out and offer support to them as well. It's very important that we don't forget carers. They have a huge responsibility looking after somebody who might be shielding, who might be unwell. And again, making sure that they get the right sort of support is really, really important. Sticking to a routine, again, is very important. Make sure you're getting up at the same time, even if it is a Sunday. Make sure you get your daily dose of fresh air, even if that means opening a window and getting some direct sunlight for at least 30 minutes a day. That's a real mood booster. It's really important for us, especially when we don't know how long this is going to last, and we are essentially locked away from the outside world for such a long time. Keeping active, again, is so important. Trying to take some time out every day for some physical exercise, whatever that might be for you. And again, there are some really useful apps, YouTube videos that you can use for this. And again, as I mentioned, don't compromise on your sleep. Make sure you are getting the rest that you need. That also is very, very important. GP practices also have what are known as social prescribers. So these are people who your GP can refer you to, and they essentially are there to help any patients who might be more socially isolated or who might need more help or support and befriending. They can give advice on what local services are available to help with shopping and so forth. So again, if you know somebody who might be vulnerable or who might benefit from that, do get in touch with your GP to see if they can arrange for a social prescriber to get in touch. And stay connected. Again, it's really nice to see older people now getting acquainted with the technology and Skyping grandchildren and so forth, and staying connected through that is probably one of the most important means we have at this time. So do try to take time out to reach out to friends and family and stay in touch. And I suppose probably one of the other most important things to mention is not to get into the habit of listening to the news all the time. I don't do that myself either. Obviously, you want to keep up to date with the important information and the government advice, but do make sure you do read and listen to the right things as well, and that they come from trusted sources. There has been a worry that there's been a lot of inaccurate information that has made its way across on some WhatsApp groups, for example, and other social media platforms. And we need to be very, very careful that we don't get led into accepting this information as being medical evidence, which can actually have really serious implications to our health and well-being, and also the health and well-being of our family members as well. So again, really important that what you are reading and listening is very much from trusted sources, but don't get too saturated with the news that's out there, because again, that can make one feel quite anxious about all the uncertainties that are around us at the moment. And so finally, what do we envisage will be the long-term impact of this virus on our health and well-being? Again, there's been a lot of speculation on this. We will have, without a doubt, have a health service at the end of this that I think is going to become even more overwhelmed. We are already seeing that to some extent. There will be indirect deaths, I think, likely to occur because the NHS has had to cancel many things to make way for this surge of COVID patients that we're seeing. We've had to cancel a lot of non-urgent but important things, like we mentioned, screening and routine surgery. And because people are afraid to come into hospital and stay at home with heart attacks or strokes or other serious conditions, this will also no doubt have a larger number of people dying from non-COVID related deaths during this pandemic. The interventions that the government has put into place for this have also had a significant impact on social and economic deprivation. And we know that deprivation and ill health are strongly linked as well. And sadly, I think we are going to be seeing more unemployment, poverty, domestic violence, and a rise in mental health problems as a direct consequence of this pandemic. Some of this is already starting to filter into general practice, and we need to try and address these issues now. We are still a very long way away from the finish of this, and eradication at this time seems technically impossible. We don't know what's going to happen when winter comes and the risk of a second wave at a time when the health service will already be at its greatest pressure. And I think the bottom line is that COVID-19 is still a novelty, if we can call it that. Evidence is building around what it means for us and our communities, what it means for the world, but there are still so many unanswered questions about this. What we can say and what we do know is that this virus has indeed changed the world, and it has indeed changed our lives. But let's hope that we come out of it in a better place. So I've just added some links there for some useful resources, and I'm sure we can send these out to you as well. You may be familiar with the Gov UK website. NHS 111 has useful updated information on COVID. The Royal College of Paediatrics and Child Health also has some useful resources for parents and carers talking to children about COVID-19, the sorts of signs and symptoms to look out for and when to get help. Staying fit, I like this website. It's got some useful information, ideas for exercise for people of all levels, so older people who might not be that physically active, younger people. So again, if you can, do try and access that as well. And Mind UK, Anxiety UK are also websites that I very much recommend to my patients. They have some useful information again on managing COVID-related anxiety, the kind of things you can do to stay positive. So again, you might find some of those useful as well. So that brings me to the end of what I wanted to say, and I will pass back on to Saiba for your questions.
Jazakallah, Sadiya. That was extremely useful and very informative. So wonderful, mashallah, mashallah. We received a few questions actually because we're running out of time. So I will read those questions out to you. Some of the questions that we received on the live event Q&A, I have replied directly because some of them were personal, but some of them I've got for you. One of the questions that we received previously via Eventbrite was, there were two questions regarding vitamin D. Actually, they're two different questions, but let's see if you can answer them together. Questions on vitamin D is how important it is to take vitamin D supplements if we sit in the garden and children play in the garden. And another question is, if the doctor has prescribed vitamin D 20,000 potency and they have finished, should we ask for a repeat prescription due to COVID-19?
So I'm glad we've brought up vitamin D because I get this question own patients as well. There's been a lot of research going on around the role of vitamin D in relation to COVID-19 and the severity of the infection in relation to this, and also recovery in people who are vitamin D deficient. And this is because vitamin D is shown to play a role in the immune system in supporting it. But how much of a role it actually plays in COVID-19 is still debatable. It won't, for example, prevent a person from getting infected with the infection, but maybe could help in recovery. And there are lots of studies and research going on around this. In terms of the question about spending time in the sun, indeed, we know that is the best source of vitamin D, and 90% of our vitamin D comes from sunlight. And the advice is to spend at least 15 minutes a day in direct sunlight. So that's not sunlight coming through your window, but actually sitting out in the sun on a day like this, for example, to keep your vitamin D levels topped up. But this also depends on your skin tone. So people of darker skin tone take longer to absorb vitamin D, and they may actually need to spend longer in the sun. But is this enough vitamin D for us, and do we need to supplement? In reality, I don't think most of us do get to spend that amount of time in the sun. And the majority of my patients who are of an Asian background, I do find are severely deficient. So I would always recommend that it's a good idea to take an additional vitamin D supplement. Again, it may be worth getting your levels checked beforehand with your GP, because you may need to adjust the dose accordingly. But anything from 2,000 to 5,000 IU, that's international units a day, which can be purchased over the counter, is not a bad idea. Again, like I said, how much of an impact that plays in COVID-19, we don't know, but we do know that vitamin D has a lot of benefits for our health otherwise, and a deficiency can lead to lots of symptoms like tiredness and muscle aches. So it's always a good idea to be topped up, and toxicity is thankfully extremely rare. The second part of
sorry. Oh yes, the prescription.
So they're part of the prescription. So if you've been taking 20,000 units IU of vitamin D, that should probably be enough to supplement you for sort of 6 weeks and replete the vitamin D levels. But the advice always is that after you've had the high dose vitamin D, you probably don't need to continue at those levels beyond 6 to 8 weeks, but you should maintain your levels by again taking a regular over-the-counter vitamin D supplement. So don't stop, because we don't store vitamin D for very long. So when you do stop taking it, don't expect that your levels will stay the same. You do need to stay topped up. So continue taking the over-the-counter dose.
Jazakallah, Sadiya. Another question for you is, if a person has high blood pressure, are they one of the at-risk groups? Now that's an interesting one, isn't it? Because recently there's some evidence coming out that maybe they're not. What is your take on it?
So my take on it, and you're right, the evidence is slightly conflicting, isn't it, on this, because the UK government website doesn't classify hypertension or high blood pressure as being in the at-risk group, but WHO do, the World Health Organization, and also the British Heart Foundation do as well. So patients do come in and ask us this question quite a lot. I think some of it comes from, I think there were studies done in China initially where they were finding that patients who had high blood pressure were dying more of COVID, but they actually found ultimately that it wasn't just blood pressure, it was also other comorbidities that were in relation to this. So I don't think there was strong evidence to say from that particular study that high blood pressure on its own puts an individual at higher risk. My own advice in this regard, I would say anybody who's got poorly controlled blood pressure is at higher risk, and that means a blood pressure, I guess, of above 150/90. Again, that will depend on other comorbidities as well. but anyone whose blood pressure is not well controlled should really be undertaking the social distancing measures. You don't need to shield, I don't think, but you should take the necessary precautions. But there are newer studies coming out on this, and again, the information may change over time. There was also some mention about some blood pressure medications, so ACE inhibitors. I'll just quickly mention that as well, which we didn't get to talk about. But this is a particular class of medication for blood pressure, and there was some concern at one point initially when this pandemic started that these can actually make symptoms of COVID-19 worse. And we were seeing some patients actually stopping these medications as a result of that without getting medical advice. But again, please don't, because the evidence around that was not compelling, and actually stopping blood pressure medication has far greater consequences than anything in relation to the studies that have been taken with regards to ACE inhibitors and COVID-19.
Jazakallah. Sadiya, can I just mention diabetes in this? Because diabetes is a higher risk factor, as we know,
Yes.
from what information we are getting from within those patients who are getting very sick with COVID and those who need to go into intensive care. And because diabetes is quite common within Southeast Asian communities, and as predominantly our Jamaat predominantly is Pakistani of Indian origin. So what I would suggest is that if you or your family members have type 2 diabetes, please make sure that your diabetes is under control. If you haven't been to your surgery for diabetic check, please make sure you book it, because the nurses are now doing it over the phone. They may need you to come in to get your blood test done, the annual one, because if you haven't had it done recently. So please make sure that you or your family members or your loved ones, that their diabetes is under control, because that's important. Jazakallah. There is a question. Is it safe to visit grandchildren with a mask on and hug them, or do you have to keep a safe distance still?
I think it depends on the individual. If they are shielding, if they are at higher risk, much of the risk that is. I would generally say not to, because children can sometimes be carriers, and I think it's just predisposing yourself to a greater risk of infection. The current social distancing guidelines suggest we shouldn't be meeting and going from one household to another. We should essentially be staying in our own home environments. So I would say at this point in time, my personal advice would be not to do that. We spoke about face masks, and we said they offer some level of protection, but again, that is limited, and we can't just use that on its own as a means of saying it's safe for us to be doing things that could be putting ourselves or other people at risk. So my advice would be not to do that.
Jazakallah, Sadiya, same here. Another question is, do you think the opening of the schools and institutions lead to another rise in cases?
That's a very interesting question. I don't know the answer to that. I think it possibly could, couldn't it? There are so many factors that need to be taken into consideration when we consider easing the lockdown and what that's going to mean. We're
just glad we don't have to make that decision. The government has to make that decision. So we would just advise people to follow government guidelines as best as they can.
Yes.
There's another question about how much at risk are children under 1. Would you like to comment on that?
So I don't think we can stratify the risk, but again, we can say that we see this infection less in children, don't we? We see much milder cases. I think if we look at the data, we see that children are thankfully less affected by it, because I think that's part of how their immune system works. They have an innate immune system, so they can sort of deal with the infection in a better way. So I think they are less affected, but like we said, there are some cases that we are seeing unexpectedly of these serious conditions related to COVID also in children. So it goes without say that there is always a risk, and if there are concerns about any symptoms in your child, always getting advice and getting them seen to straight away.
Okay, Jazakallah. I think we have covered almost all the questions. Some of the questions, as I said earlier on, I replied directly to people as well. Jazakallah, Sadiya. I know you've put such great effort into this webinar. So Jazakallah for your time and providing us with such informative and interesting webinar on COVID-19. I would also like to point out that I know lots of people who registered to attend the webinar couldn't log in, and there were some technical issues with Microsoft Teams. I think, inshallah, as we continue these webinars in future, people would get a hang of it and how to get into it, or we would also know that what other technical support we can provide them, and we would follow up. One good thing about Microsoft Teams is that it records the event. So inshallah, we will post this on our website, the audio of this event, so those who could not join us could benefit in that way. So Jazakallah to everyone as well who gave your time and joined in, and mashallah, we had very good attendance. So Jazakallah everyone, and stay safe and keep praying. Jazakallah. Jazakallah, Sadiya.
Jazakallah, Sadiya. Thank you so much for to all our participants for joining as well. Thank you so much. Assalamu alaikum.
Alaikum.